Quinn, many ask the question, why do I need to visit a doctor to refill my prescription if I only need that same medication I've been taking for over a year? Dr. Timothy Quinn is here again to explain to us. Hey, Dr. Quinn. So when patients come into your practice with this complaint, what do you tell them?
Well, Ty, gets so many patients to come in with this complaint, and some patients actually get very angry. They'll report that, doc, I've been on the same medicine for the last 2 or 3 years. Why do I have to come in and get my blood pressure checked? Why do I have to get blood work done? Why do I have to pay a copay? And why do I have to take off work? What's really behind all this? But what I explained to them that the bottom line is what's behind everything is safety for you. Because at the end of the day, the medication can have side effects. It can make your blood pressure go too high or too low, or maybe it could even interfere with your kidneys or your liver. So we want to check those vital signs. We want to do that blood work because we want to make sure that the medicine is safe for you.
Okay, I get you. So what are some more common medical problems then that you would say require more frequent follow-ups at your clinic?
Right. These most common chronic medical conditions include hypertension, diabetes, and hyperlipidemia or elevated cholesterol. These are the big three where you have to come at least every 6 months to check, because the medications that are used to treat these conditions can cause side effects. But the good news is, if the medicine is interfering with you, causing you problems, if it's diagnosed early by doing monitoring, say, for instance, your blood pressure is now too high because the medicine is not strong enough, or if you have elevated kidney enzymes because your kidneys are having a hard time getting rid of the medication, or your liver, it can be identified, and then we can switch to another medication that's safer for you, or now more effective because maybe your blood pressure needs more strengthening of a medication. But the take home is it's overwhelmingly for safety, because at the end of the day, if you keep prescribing the medicine and you're having problems and it's not being detected, by the time you start having problems, it could be too late and irreversible, and you could even have problems such as kidney failure, which could take your life. So at the end of the day, after I explain this to my patients, they're usually good and they understand and they say, hey, doc, thanks.
I got you. Thanks so much, Dr. Quinn, for your time. That's all the time we have for this afternoon.